My name is Jeffrey Boschman, and this research is about the utility of color normalization for AI-based diagnosis of H&E-stained pathology images. Hematoclin and eosin-stained slides are a routine tool for pathologists to look at tissue samples and diagnose diseases. There's a huge potential for artificial intelligence and machine learning to supplement pathologists in this task, but one major obstacle is that the color of H&E slides can vary greatly. Although human pathologists can adapt to these color differences, this really affects computer-aided diagnostic systems. Many color normalization methods have been developed over the past 20 years, but their generalized utility for deep learning hasn't been studied enough. So we did a comprehensive study comparing various methods, and so what we did was, for a given dataset of whole set images, image patches were extracted from all of them. Then we made a version of these patches that went through a color normalization method and evaluated them on a deep learning classifier to get the patch level results. Then we calculated the slide level classification results by majority vote for the patches from any given slide. We repeated these steps for 5 datasets and 8 color normalization methods, each with 3 different reference images and 3 cross-validation splits. Then for each dataset, we compared the results of the different color normalization methods against each other and against the case where no normalization was done. We found that color normalization does not consistently improve diagnostic performance when train and test data are from the same center. Looking at the 3 box plot figures, which are from 3 datasets of different cancer types, the x-axis has the different color normalization methods, where blue on the left is with no color normalization, and the y-axis is AUC results from multiple cross-validation split and reference images. We found that no method is consistently the best across the datasets. You can see this by the huge variety in these box plots. As well, the cross-validation split and reference image chosen often made a huge impact on the exact result. However, when train and test data from different centers, color normalization does improve results. Moreover, as we can see from these 4 box plots on the top right of each plot, we found that by mixing patches from multiple methods and reference images, we can consistently get results that outperform most of the singular methods. The rationale behind this is that if there is not one normalization method or reference image that is ideal for all datasets and tasks, training a model with normalized images from multiple methods and references should make it more robust. The goal is a robust enough model for clinical practice to supplement pathologists. For example, it can be used to increase the accuracy of diagnoses by general pathologists and alleviate the workload of specialist pathologists, such as by providing a second opinion or classifying the obvious cases so they can focus on more complex ones. Thus, it will allow more patients to be treated earlier and more effectively, and accordingly reduce the deadliness of diseases.